الحلم بدأ من 2009 من مجرد فكرة شغف إننا نغير مستقبل زراعة الأسنان في مصر والوطن العربي، وخلال 16 سنة قدرنا نحول الحلم ده لواقع ملموس، مش مجرد أرقام، دي قصص نجاح. آلاف الدكاترة والطلبة اللي غيرنا حياتهم، علمناهم ودربناهم وفتحنا لهم أبواب المستقبل عن طريق مؤتمراتنا العلمية وندوات أونلاين وأوفلاين كل شهر وفي كل مكان. بنواكب أحدث التطورات وبنشارك خبراتنا مع الكل بشهادات معتمدة من الجمعية الأمريكية لطب الأسنان ADA. رحلة بدأت بستيب تو ذا فيوتشر 1 و2 و3 و4 ولسه مكملين في النسخة ال5. إحنا بنبني مجتمع من أطباء الأسنان اللي عندهم شغف يقدموا أفضل خدمة للمرضى، وإحنا هنفضل ندعمهم ونشجعهم ونكون معاهم في كل خطوة.
مساء الخير يا دكاترة، عاملين ايه؟ هنبدأ النهاردة يوم جديد من أيام مؤتمرنا First Step to the Future. هنتكلم النهاردة في يومنا 19 مع دكتور أنجيلو كارديلي، واحد من أهم البايونيرز في مجال طب الأسنان، مش في مصر ومش الوطن العربي، from Italy. Hello دكتور أنجيلو.
Hello, good afternoon and salam alaikum and Ramadan Kareem to all of you.
وعليكم السلام، الله أكرم. We are pleasure to have you in our conference.
The pleasure is mine.
Thank you. You can start your lecture.
Okay. I'm sharing the screen. Can you see now?
Yes.
Can you see my presentation?
Yes. You can start, doctor.
Okay. So the topic of this lecture, it will be about customized implant. What I mean, this is a new approach in order to treat atrophic patients, because as you know, if we have a patient in which we don't have enough bone, sometimes it's very difficult to treat this kind of patient. So the customized implant, this is a new approach that we can use in this kind of patients in order to reduce the invasivity and morbidity for our patient. And also we can do immediate loading. And I will show how we can do in order to achieve the best result in terms of the aesthetic and in terms of function. So before to start, a few words about my activity. Basically, I share my activity between Italy and UAE because I work in Italy in my private clinic, and also I'm working in Dubai in Alchemy Polyclinic in UAE. So I have the possibility to treat a lot of patients during my activity. It's very important to know those it's very important. Sorry, it's very important to know those dates. In the upcoming years, we will have a lot of edentulous people in one or in both arches. So basically, from 2030, we will have about 30 million of edentulous people. So we need to have in our hands a good technique in order to solve and in order to treat those patients. Okay, just a few things about the bone resorption, because as you know, if we will remove only one dental element, we will have an important bone resorption with different direction and different speed according to the quality of the bone in the maxilla and in the mandible. As you know, in the maxilla, basically we have a soft bone and a cancerous bone. In the mandible, we have cortical bone and hard bone. That's why we have two different kinds of bone resorption: centripetal resorption in the maxilla and the centrifugal resorption in the mandible. We need to know that in order to manage also the prosthetic part. So if we have a patient like this, in which we don't have enough bone, is a huge bone resorption. We have many options. We can do bone regeneration, but we need to consider the invasivity and the morbidity. We can do, for example, zygomatic implant, and this is our book, just came out 1 year ago with my friend Arun Garg about the use of the zygomatic implants in atrophic patients. But as you know, for example, in the maxilla, as you know, the zygomatic procedure is an invasive procedure, and we have a lot of complication, infection, mobility of the implants. That's why with the customized implant, actually we have another option in order to reduce the invasivity and the morbidity, maintaining the same outcomes and the same result. This is the present and this is the future. This is the customized implant. The customized implant is a titanium framework, as you can see, that we can receive from the CBCT with fully digital workflow. And I will explain better what I mean. So it's the first time that we can get this kind of a customized implant from titanium dust. So from titanium dust with the laser sintering process, we can produce this customized implant, and we can use for small bridge or for full arch rehabilitation, and also we can do immediate loading. So the customized implant is an old concept, but with something new. Have a look the previous one. This is the old concept. As you can see, in the past, we didn't have the screw to reduce the mobility. Also, the quality of the surface was poor quality. It's like a poor quality surface means a lot of problems in terms of the bone resorption and soft tissue adhesions. So those are the old concept about the customized implant. This is the new concept about customized implant. This is the present and this is the future that we can produce with the digital workflow. So in the past, we had the customized implant, but we had the mobility of the implant without screw, chronic infection, soft tissue adhesions, implant exposure, and also we didn't have the possibility to make screwed prosthetic restoration. The only solution was cemented. And as you can see, the cemented restoration can cause a lot of problems for the cementation, for the inflammation, and also for the micro movement. That's why now we can escape this problem using the screwed restoration. Have a look those old cases with the previous customized implant. A lot of infection, a lot of soft tissue exposure related also to the cementation, and also mobility. And if we have a mobility, we have micro movement and we will lose bone. So we will have an important bone resorption. Also is different the production, and I will explain what I mean. Basically, now the surface is completely different because we can say now we have titanium grade 5. We have a screw in order to fix the framework. We have the prosthetic screw, so multi-unit abutment, and we have a perfect fitting on the bone because now we can use the 3D CBCT in order to produce this kind of a customized implant. This is just an introduction. Have a look. This is the new concept of customized implant. I will show later on the details about this case. But anyway, he's a 73 years old patient, no bone in the posterior side of the maxilla. So the solution is to use customized implant, 7 screw to fix and to stabilize this kind of customized implant. As I told before, the surface of this customized implant is completely different because now the surface is treated, and also we can have the more stability in terms of the micro movement. So which are the indications? The indications are the patient in which it's impossible to perform the standard surgery. For example, implant, standard implant placement, or bone regeneration, because as you know, sometimes the bone regeneration is more invasive for the patient, especially for old patients. Okay, that's why we can use now the customized implant. And which are the contraindications? General contraindication according to the health of the patient. And don't forget that in the patient with the chemo and the radiotherapy, we need to wait at least 1 year before to perform the surgery. But basically, we need to know the health of the patient, and we need to have the CBCT in order to produce, in order to understand the anatomy. And which are the advantages? Less invasivity, less morbidity, no waiting time because we can do immediate loading and immediate restoration. We have the osseointegration of the screw, and we have a perfect fitting on the bone through the CBCT project. This is an important thing. But for sure, in this kind of patient, in this kind of procedure, we need to have more experience about the surgical procedure. I mean, we need to open more the flap. We need to manage correctly the soft tissue because we need to cover completely this kind of titanium framework. And for example, I will show later on in the maxilla, we need to use the bola del Bichat, the fat that we can have in the cheek in order to cover with double layer in order to cover this titanium framework. There are also some differences compared with the previous, because in the past, in order to produce this kind of a customized subperiosteal implant, it was analogical way. So it was necessary to open the flap, to take the impression, to close, and in the second surgery to open again to put the subperiosteal implant, because it was analogical workflow. But now it's completely different. We can reduce the surgical time in only one step, because from the CBCT, we can plan, we can produce the customized implants, and we can do directly our surgery. And I will show step by step how we can do. Or it was an hybrid concept, but now, as I told before, we have fully digital workflow. So it's the first time that now we can produce this customized implant from titanium dust. And this is the 3D printing model that we can receive from the company. Everything starting from the CBCT. This is the 3D printing model, and this is the plastic customized implant that we can use as guide in order to manage correctly the flap. And I will show how we can use this plastic guide. It's very interesting to see this video because we can understand this new concept. So from the CBCT, we can receive this amazing and precise 3D printing model. In this case, only 7 screws in order to fix and stabilize this customized implant. And this is the project. So, for example, in this case, we have 7 screws. All of them are 1.2 millimeter. The length obviously is different. according to the residual bone that we have. So we need to follow this project, and in that case, we need to put 7 screws in order to fix and in order to place this kind of customized implant. And this is the machine that we can use in the factory in order to produce the customized implant. So for the first time, we can produce the customized implant, this titanium framework, only from the titanium dust with 3D lasering sintering process. That's why this device is very, very precise, and we don't have any problem in terms of the stability when we will put this device on the bone, and I will show. But have a look through some clinical cases, and I want to show this clinical case in order to understand how we can produce and we can manage this kind of surgery. This is the patient, 73 years old, as I showed before. So we don't have a bone in the posterior side of the maxilla. This is the situation before. Have a look also, the soft tissue is very important to see and to understand the quality and the quantity of the soft tissue, because the soft tissue management is mandatory in this kind of surgery, because we need to cover completely this titanium framework, otherwise we will have a lot of soft tissue deviations. So we can take the CBCT, and from the CBCT we can receive from the company this first project. Okay, so we can receive this project and we can see if everything is okay according to our workflow, according to our experience. So when I saw this project, I decided to change something. Why? Because I want to increase the stability and I want to reduce any kind of micro movement, because we are in the maxilla and we have the zygomatic area that we can use in order to increase the length of this customized implant. That's why now we can change something. Okay, we can change something, and compared with the previous one, I decide to increase the length of customized implant exactly like this, just to put 1 screw more in the zygomatic area, and we have 3 multi-unit abutment for 3 crown. Why I decide to change a little bit this project? Increasing the length on the zygomatic area in order to increase the stability and in order to reduce the micro movement according to the occlusal force. So I decide to use this new project in order to go ahead with the surgery. So we can send the file and we will receive this customized implant 1 month later. 1 month later, we can receive this 3D printing model, as I showed before. It's very, very precise. This is the occlusal part, and this is the palatal part. Also, we have 2 screws in the palatal side. That's why we need to open the flap on the buccal and on the palatal, and we need to fix and to screw 2 screws on the palatal side. As I told before, in this kind of surgery in the upper jaw, we need to find this fat, and you can see here through cadaver dissection, this fat you can find in the thickness of the cheek. And this fat is very important to use in this surgery, because with this fat we can cover this titanium framework. So this is a protection for our customized implant. Just to release, we don't need to cut. We can find this fat in the thickness of the cheek. Then we can use to cover the customized implant, just to make the suture and just to create a double layer of flap and fat. But it's mandatory to use in order to have more protection in this area. But have a look at the surgery. So we will receive the 3D printing model from the company, and this is the plastic guide. Let's start with the surgery. All of this surgery, I'm doing this surgery with the conscious sedation, with the anesthesiological support. Why? Because we can control better the anxiety, we can control better the blood pressure, we can reduce the bleeding, and we can increase the surgical view. So have a look at the 3D printing model and you can see then the clinical situation is exactly the same, means high precision, because we are using the titanium dust with the laser sintering process. This is the important thing. That's why if we are following this workflow, we can achieve a very high, precise, customized implant. This is the plastic guide, and I will show how we can use in this surgery. Okay, before to place the titanium framework. So we can start with the surgery. It's very important to start with the right incision, a little bit palatal. Why? Because I want to see the bone on the palatal side, but at the same time, I want to increase the keratinized tissue. That's why have a look. The incision is palatal. Because if we will do the incision exactly in the center of the crest, we will lose the connective tissue. Which kind of flap? Trapezoidal flap. So 2 vertical incisions, 1 mesial and 1 distal. Why? Full thickness flaps, of course. Why 2 incisions? Because I need to release, as I told before, more. I need to have the maximum surgical visibility. That's why I'm using full thickness flap, trapezoidal flap with 2 vertical incisions, 1 mesial and 1 distal. Full thickness approach. So slowly using the periosteel, we can disconnect and we can separate the tissue from the bone because we are doing a full thickness flap. So slowly to reach the bone. And of course, we need to open the flap also on the palatal side because as I told before, in this surgery, in this case, we will place also 2 screws on the palatal side, 5 screws in the buccal side. Have a look. Now I'm using the plastic guide. Why? Because I want to understand if the flap is enough or not. As you can see, it's not enough because I can't see the zygomatic area. So that's why I need to release more and I need to open more the zygomatic area because according to this project, I will put 1 screw in the zygomatic arch. So I need to see more. That's why using the plastic guide, we can manage better. I'm doing some incision with the blade to increase the elasticity and to increase the visibility. Now the zygomatic area, it's more clear, so it's enough. And we are ready to put the implant. Also through the soft tissue, now you can see something, tissue with yellow color. This is the fat, okay? And I will show, this is the fat, and I will show how we can use this fat at the end of the surgery to cover the customized implant, okay? Now I'm making some incision to open more periostal incision. And when we will put the customized implant, it will be already stable, means high precision. That's why it's important to understand this concept. It's important to have a precise device, otherwise we will have a lot of mistake in terms of the micro movement and not perfect fitting. So now the bone is ready to host the customized implant, so we can open the package and we can put on the bone this customized implant. The surface is treated. We have 3 multi-unit abutment for 3 screws with the crown. So this is one of the difference with the previous one, with the old concept of a customized implant. Have a look at the shape. This is the exact shape that we did from the CBCT. And it's very interesting to see this. When I'll put the customized implant on the bone, it will be already stable. That's why after that it's very easy to finish the surgery. Already stable without screw means high precision. Okay, it's completely stable. Now just to start the screw placement. As I told before, we have 7 screws, 5 on the buccal and 2 on the palatal. All of them are 1.2. The length, as you can see, is different, obviously, according to the residual bone that we have. The final result is the stability of this framework, okay? Titanium framework. We can continue with the placement. It's very interesting when I will place the last screw in the zygomatic arch, because it will be the longer one, 30 millimeter, to achieve the final stability. That's why I decide to change the previous project in order to increase the length on the zygomatic area. This is an important thing that we need to know, and we need to think about that. Then we can continue with the screw just to finish on the buccal and on the palatal. Here we have a 7 screw. So we can continue and have a look. It's already stable. So now it's very easy to finish the case, to finish the screw placement, because also we have a good stability and a good surgical view just to continue this screw placement. The last screw, it will be the screw on the zygomatic area to achieve the final stability. Have a look. We have a space between the titanium framework and the bone, but when I will screw the screw itself, you can see that we will have a close contact between the titanium framework and the bone, means high precision. This is an important concept, okay? If we don't have this precision, it's impossible to perform the surgery because the device is not stable. And if this device is not stable, we will lose the stability, of course, and we will lose the bone. And we will have soft tissue exposure and we will have infection, okay? Then we can continue on the posterior where the bone is very soft. Then on the palatal side where the bone is very hard, 2 screws on the palatal side, and the last one on the zygomatic area, the longer one, 13 millimeter and 1.2 millimeter of diameter, okay? But it's already stable. So now it's very easy to put the last drill. This is the last drill on the palatal side. Now it's very interesting to see the last drill that I'm putting on the zygomatic area, exactly like this, okay? Here the bone is very hard, okay? And have a look now the screw, 13 millimeter, okay? To fix the final stability, and that's it. Now it's completely stable. That's why now we need to finish the case using the fat. So we need to make the incision on the periosteal to reach and to find this fat. This is the fat that we have in the thickness of the cheek, and we will use this fat to cover the customized implant in order to create a double layer, okay, in order to protect the customized implant, in order to avoid the soft tissue exposure and the soft tissue adhesions. This is the Bichat that we will use. So with the flap now, we will use with the fat now, we will cover the customized implant just to make the incision with the suture. So we will hold this customized fat on the top of the customized implant just to fix with the suture, reabsorbable sutures. So we will create double layer, fat and flap on the top, in order to be sure that this customized implant is completely covered and protected from the fat and from the flap, okay? Then we can make the suture, and we can do reabsorbable suture, like this, okay? 4-0 reabsorbable suture, and this is the final suture. 3 healing cap. This is the occlusal view. In this case, I didn't make the immediate coding, but if you want, you can do. And this is the OPG. This is the OPG immediately after. So this is the situation few months later, when I took the impression with the scan body, so is 6 months later, I took the impression to make the temporary, then the final restoration, okay? I took the impression with the scan body, with the digital workflow, and I want to show the final restoration. Screw it with ceramic material. Okay, this is the CBCT 6 months later. It's very important to see the CBCT to understand that we don't have any kind of micro movement, and we have a perfect fitting between the customized implant and the bone. It's completely stable, no micro movement. Have a look here. Perfect fitting and stable. And this is the final result and the final OPG to shows the osseointegration and the healing of the soft tissue. This is the details about this final restoration, and this is the occlusal view. So at the end of this short lecture, what we can say? We can say that this procedure, the customized implant procedure, is a valid alternative in the atrophic patient, especially in the maxilla, in order to avoid zygomatic implant. Is less invasive of zygomatic implant and we have a less complication. So if we have a patient in which we don't have enough bone, we have this option in order to treat our patient. So thank you everyone for your kind attention, and if you have any question, please feel free. Thank you again.
Thank you, Dr. Angelo. It was a very fantastic lecture. Thank you.
Thank you very much. If you have any question, please feel free.
Okay. Any question, please? لو في حد عنده أي أسئلة يا جماعة يقدر يقول. No question, يا دكتور.
Okay.
Okay, thank you very much. We are pleasure to have you.
Thank you very much. Bye-bye.
Thank you. Bye-bye.